Hi everyone, welcome. We're just letting everyone join and we'll start in just a moment. Great, folks. As you can see, we're asking you to introduce yourself in the chat. We use the chat a lot for those of you that have been to our webinars before. Thanks for coming back for another one. So we like to start by everyone putting something in the chat. We'd love you to introduce yourself, tell us which member organisation you're from, which country you're on. I'm in NAM at the moment. Let us know your pronouns, so if we're talking to you, we know how to respond to you respectfully. And in a moment, we'll get started. You'll notice that we're recording, so we'll be able to share the link to this webinar with you afterwards. There are a few slides here, but remember that you don't need to write it all down because we'll be sending it to you not in the not too distant future. So we've still got a couple of people joining. We'll wait maybe just another 10 seconds because I am keen to get started. And then we're going to hear from a consumer. So going to wait for, we've got 20 people online and 19 people yet to put in the chat where they're from. And a special welcome to Saba, who you're going to hear from in a moment on video, who was with us on budget night and shared her thoughts about the experience. Thanks, folks. We've got a couple more people putting the names in the chat, but we've still got a few missing. So you can see we've got Hepatitis Australia here, one of our board members, so I better behave myself. Welcome, Daryl. Few CTF staff putting the names on too, terrific. We're going to make a start, folks. We are missing a few folks, but I'm conscious that there's a lot to get through and we're really keen to hear what you think about the budget, and I want to allow plenty of time for that too. So let's see, what did consumers think of the budget? Here's a quote from Saba, we've just seen. Thank you. And I'm going to start also, I did mention I'm in NAM. I would like to acknowledge the traditional owners of the lands where we're meeting, where you all are, and it's great to see people from all different parts of Australia. Saba's Wiradjuri. I'm in Ngunnawal and, sorry, not today, I'm in the, I'm in NAM, so it's the Wurundjeri people of the Eastern Kulin Nation that I would like to pay my respects to, but I'm sure you all would do that too, and acknowledge their continuing relationship with the land, thank them for the opportunity to work and play, live on their land, which has never been ceded, and also acknowledge any First Nations people who are with us today. So hello to everyone, and for those that haven't had a chance, we're all introducing ourselves on the chat, so it'd be really great if you can do that too. So I'll just give you a quick rundown. You can see there on the slide, we're going to run you through the budget, talk to you about what people have said, and then really kind of ask you where to from here. And during the session, we love it if you can share your thoughts with us on the chat, if you've got thoughts. We also really like you to use the reactions. So down the bottom of your screen, you'll see a heart there with the react. Love you to just go in there and just let's do a practice. There's a clap, there's a thumbs up, there's a party sign. Everyone just press one or two things, just get the hang of it. Make sure you know how it's working. You can be laughing, surprised, whatever it is. That's great. So we really encourage you to do that during the session. And even in the chat too, Sarah, fantastic. So that we know how you're thinking about things. You can either put your comments in there. There's a Q&A section to put your questions in as well too, of course, if you have any. And we'll run through the budget context itself. This is a members only webinar. So CHF is a peak body, so we have a number of member organisations. So really like to say hello to all of you from our member organisations today. One of the things, one of the values, if you like, that we provide for our members is that we like to keep them up to date with what's going on. We did a lot of work prior to the budget and the election with our members last year, asking what are the important issues for them. And it's really great to see that some of those things that were raised by consumers actually have been addressed in the budget itself. So really keen, as I said, to hear your thoughts. And the election, of course, just about up and running early this morning. So now it'll be interesting to see what, if anything else, comes our way from health during the election campaign. What are the yet to be released things? So we're going to do some polls during this. So these are where you can vote. If you haven't used these before, Zoom will put something onto your screen asking you to vote, and then you can choose to do that. So here's our first question for today. What did your organisation think about the budget? So you just pick 1, 2, 3, whatever you like. I can't vote, just so that you know, and we'll share you those results in a little while. Okay, great. So let's look now at what consumers said they wanted to see in the budget. When we talked to you and asked you what your organisational members and people, communities you work with, great, thanks, Shannon. So you can see people wanting more done, generally thinking the budget's okay, but wanting to see a lot more done. And we may well find out that more will be done during the election campaigns by all of the people hoping to be in the 48th Parliament. Let's wait and see. It's the fun part now. So let's move on to the next slide and see, well, before the budget, what were people saying they wanted to see in the budget? So these are the key areas that when we went out to the community and also out to you as our member organisations and asked people what they wanted, these are the key things. I don't think anything in here would be surprising to those of you watching this. Affordability is huge, we know, and almost dwarfs every other healthcare issue at the moment. It's almost, first, if I can afford it, then I can talk about the quality of the service. But if I can't afford it, I can't even talk about that. People do really want to stay out of hospital. So services, prevention, services where they can get help early. They might be digital services. That might be knowing how to navigate the system. All of this is really important to people so that they can get the care they need as quickly as possible. So let's hear what Saba, oh, sorry, thanks. That's great, Shannon. Let's hear what Saba had to say about the budget. Oh, I don't have any sound. Just bear with Shannon a moment. Let me see. Let me just get that sound happening. Did anyone else hear Saba? It might have just been me. It'd be great if you put in the chat whether you could hear her or not, because I couldn't hear. No sound?
On healthcare.
Thanks, Naomi.
Hi,
oh, there we go. We've got it now.
South Wales. As a migrant mom with a young family, I appreciate the government's emphasis on healthcare in 2025 federal budget. I'm really happy that the government is spending $7.9 billion on bulk billing doctors, which is really needed because there's a lot of out-of-pocket expense if you want to see a doctor just for a referral or just for a child to get vaccination. Also, I'm really happy that the government is investing in 50 Medicare urgent clinics. Hopefully, we will get some in the regional towns as well. Also, I'm really happy as a woman that the government is spending and the government has promised to spend funding for the women-centric programs and some of the raising awareness and everything, because as a woman I always feel that we don't prioritize our own health. So As a person living in a regional area with a teenage and a toddler, I'm really happy with the budget. Hopefully, the budget will do justice to the regional community as well. Thank you. Hi, I'm Saba, and
Fantastic. Thanks, Naomi. I just said for everyone to be great if they thank Sabra, and you might like to use your emojis to give us some thanks for wading through all the budget papers with us and for her commentary. She told us a little bit about her own experience being rural, being a mum, being a woman, and how the budget impacted for her. Sabra, I hope you're enjoying all the love that you're getting. So we, as you know, many of you know, because you will have been involved, we went out to you all before the budget and before the election that's now started and said, okay, what is it that you want? And so now we've had a bit of a look and said, well, what was actually in the budget that we're asking for? So really key was this issue of affordability. And we can see that in the budget. A lot of the things, both in health and outside of the health portfolio, have been about trying to reduce your out-of-pocket costs and increase the social wage so that you can afford to do the things you need to do. If bulk billing rates lift up to 90%, that will make a big difference to many people. Keen to know what you think about the bulk billing stuff. Use your emojis, good, bad, or indifferent. Are you happy about that? What are people thinking? You'd like to see more bulk billing? Is it important to you? Thanks, Janie. You think it's very important. That's great to know. Someone else has got a thumbs up. 2 people like bulk billing. Oh, 3 people like bulk billing. Fantastic. Oh, no, more. They keep coming slowly but surely. And then cheaper medicines. So reducing the copay. So this means when you go to get a medicine and you're not on a healthcare card, instead of it costing you $31, it'll cost you $25 from January next year. Janie's a big fan. She likes to reduce medicines as well. Fantastic. And then the investment in women's health, which is quite substantial, and we'll talk about in a moment. So the budget context, so it is the 4th budget, and you will have heard the Treasurer and Prime Minister and others talking about that. We are in interesting times with a budget just before an election is supposed to be called. And, you know, many people thought there wouldn't be a budget because the election would be called earlier. But in part, the cyclone that occurred in Queensland really changed the timeline for all of these things. And you can't really see it in this picture, but these are the smallest budget papers I've ever seen. To pick them up, they were very, very light. And we think that's in part because they were perhaps produced a bit quickly. Health is clearly a big winner from this budget, though. You can see the big investments into health that are so important. Reinvesting in Medicare, $8.5 billion is a lot of money in anyone's language, and it's a big budget measure. And it's really clear from watching the Treasurer's speech that the government really understands the impact that the continued cost of living crisis is having and wants to help us pay for the things that we need to pay for on a daily basis. We've certainly been hearing about that at CTF. People regularly talking to us about how they can't afford the things that they want to afford. So let's have a look at the details. So the total investments in health, $13.2 billion. That's a nice big investment. And there are really these 5 themes. I mean, strengthening Medicare in so many ways. You see it playing out through the urgent care centres, the health workforce funding, the women's health, which includes some, you know, new item numbers for women's health issues, and the bulk billing, which is the big ticket number. This is, as the government said, one of the biggest investments. Oh, sorry, I wasn't quite finished there, Shannon. This is one of the biggest investments ever into Medicare since its creation. We know that people think that their Medicare card means if they go somewhere, the service should be free. And we also know that if it's not free, it should be affordable, is what people would assume. But the rising out-of-pocket costs of healthcare mean that even with a Medicare card, people can't afford to go and get help. And as a consequence of that, they don't. and this has dire consequences for their health and well-being, and that needs to change. So this move, particularly to bulk billing, we would hope makes that difference. And we think the government has set a bit of an expectation with consumers. We think that Australians now want to see that bulk billing change. So it's not just the government's giving the money. Now we're relying on the sector, particularly for the bulk billing one, general practice, to make that change and want to see those 90% of GP visits bulk billed over the next few years. And there is an expectation, I think, from the community that primary care, particularly general practice, will work very collaboratively now with the government and others to make sure that happens. I would say that people aren't just asking, we're almost to the point of people demanding. People are feeling desperate about not being able to get access to care. And so we hope that this budget measure will indeed be fully spent. That is, that GPs and general practices will engage with this, and that $7 billion will go through to general practice and really allow us to get the healthcare we need. So if consumers wanted this, what did the sector think about the budget? We've got a couple of slides here that give you a bit of an outline, and I'll just let you kind of read through these a little and make a couple of comments for some of the key players. So, I mean, ACOS was happy with the investments in health, but still the Raise the Rate campaign has not yet come to a successful conclusion. And there is a sense that the budget was really aimed at middle Australia and not necessarily at people who were struggling to find the money to do what they needed to do. The AMA, so we saw that $8.5 billion say that's okay, but we need more. Allied health, really there's not much in there for the allied health community. You can understand why they were not particularly happy. And it's fair to say, as you go from each different sector leader, there are quite different views about the budget. So while some have welcomed it, as many of you did just now, others have said that it's too skewed towards doctor-related reforms and less towards the rest of the care team, nurses, allied health professions, even helping address the issue around specialist costs. Thanks, Shannon. So here are some more kind of quick, and I'll just let you kind of have a read through. Remember, you're going to get these slides when you get the copy of the presentation, so don't feel you need to record this all for posterity. You'll be able to look at this again at your own leisure. So COTO were happy with the support in residential care. They would have liked to see the oral health plan, as we would, funded, but it hasn't been, which is unfortunate. Mental health, a lot of the mental health advocates calling out the fact that there wasn't really a mental health budget and that there is significant unmet need in mental health, which I think many of you would also experience. Next one, thanks. So again, you can see NACHA saying there are some good measures, the National Rural Health Alliance saying it's a bit of a mixed bag. So there's very much, as you look through the views of the sector, this mixed response. With some people, if it's funded, something that they wanted, so the Pharmacy Guild were calling for cheaper prescriptions, they've got that, so they're happy with that. Where others who were wanting an investment in prevention, like the Public Health Association of Australia saying, where was that prevention investment? And the media, well, what's the media saying about the budget? Well, generally they've been pretty positive about it, particularly in health. So again, we've got a few slides here from some different media outlets, which we'll run through just to give you a sense. But you'll see the Sydney Morning Herald and on the next slide, the ABC, all really saying there are lots of winners in health, particularly here they've even drawn out not just health, but health, women's health. The urgent care centres don't seem to have featured so much in the media. More the bulk billing, the cheaper medicines, and some of the work to improve access to doctors, whether that's workforce or the money being provided into hospitals. And what did the minister tell us? Well, he said that the budget demonstrates a real commitment the government has to strengthening Medicare. And he's hoping that the PBS copay, which returns it to what you would have paid in 2004, so that's a long time ago, will really make a difference for people. And he also started to talk a little bit now in some of the forums about what he will do and what a Labor government will do if they're re-elected. So listing out those reforms that I mentioned there. So there's a budget breakfast some of you will be aware of that happens a couple of days after the budget, and we were there, a few of us, and got the opportunity to ask a minister a question, and you're going to hear live my question and his answer on the video. Thanks, Shannon.
My name is Elizabeth Deveny. I'm the CEO of Consumers Health Forum of Australia. First of all, congratulations, Minister, on the budget. Really terrific to read the detail. CHF hears daily about people who can't afford their care. And we know that, for example, 1 in 6 kids in Australia live in poverty. So the decisions the government's made to make care more affordable are very important for many Australians. At the same time, providing $8.5 billion into general practice, we hear that some doctors think they need more. And we see specialists charging hundreds of dollars for a visit and not using the government's own cost finder mechanism to help people be able to afford the care that they really need. So my question to you really is, how will the government make sure that this massive public spend means that people do pay less for their care and the money doesn't simply go into the pockets of providers?
Thank you for the work that CHF does, and thank you for the work that every patient group does. I try to constantly remind myself, sorry for splitting that infinitive, I try constantly to remind myself of the importance of elevating the patient voice. I talked a lot about stakeholders in my introduction. Industry groups and clinical groups are very well organised, very well resourced, very well intentioned, but we constantly have to work at elevating the patient and consumer voice as well. And your organisation is central to that, bringing together all of the different, literally dozens and dozens of patient groups. And thank you for that work. Look, there has been a bit of public discussion about the Medicare investments we've made and some different views that perhaps we should just increase some rebates and hope that that leads to a turnaround in bulk billing rates. I couldn't do that in good conscience. We had good faith discussions with different groups, including doctors' groups, about that as an alternative pathway. But I have a particular responsibility as a Labor minister to turn bulk billing around. That for Labor has always been the beating heart of Medicare. And so I'm not willing to put a whole lot of additional investment into rebates without strings attached. And that string is really a bulk billing outcome. And I'm confident as we continue to crunch the numbers with doctors' groups and with doctors, that they will see that it is in their financial interest to take up the offer, effectively, of bulk billing non-concession card holders and receiving that additional income, not just the bulk billing incentive at its tripled rate for the first time for non-concession card holders, but also the 12.5% loading for practices that become fully bulk billing practices. Tripling the bulk billing incentive in 2023 lifted the incomes of GPs by literally tens of thousands of dollars a year. Literally tens of thousands of dollars a year, whether they were fully bulk billing doctors or doctors who were mixed billing. If they were bulk billing pensioners and kids, literally tens of thousands of dollars of additional income. Good for them, good for the viability of general practice, but good for patients as well. And I think a significant reason why more junior doctors now are choosing general practice as their preferred training course. We've got more junior doctors in GP training this year than Australia has ever had before. We want to see it higher, but I think rebuilding the dignity of general practice, the value of general practice, has been important. If they take up the additional offers of the bulk billing incentives and the practice payment in this week's budget, they will earn tens of thousands thousands of dollars more again. I'm confident that they will see over time it's in their interest, and I absolutely know it's in the interest of patients.
My name's Elizabeth Deveny, I'm the CEO.
Thanks, everyone. So you can see the Minister very concerned about getting those bulk billing rates back up, and let's hope he's able to do that. Now I'm going to run through those 5 key measures in a little more detail. I'm going to ask you each time, a thumbs up, thumbs down, how did you feel about each one? And we will be writing to the Minister to congratulate him on the budget and also ask him what's next. So as we go through this, really keen for you to put in the chat if you like, or if you've got a question for me, you can put it in the Q&A. What are the kinds of things, questions, issues, comments, concerns, congratulations, whatever it is, that you would like us to include in that letter? So if you want to say, well done for bulk billing, let us know. If you want to know what's happening about the PBS safety net and how that cheaper medicines might impact on that, let us know. Because we're keen to understand, if you were writing the letter, what you would put in it and make sure that we cover off on as much of that as we can. So let's have a look at the first measure, which is the bulk billing measure, which we've already mentioned. So the Minister talked about that and explained that practices will get an incentive now to bulk bill for everyone, not only those people that were young and on healthcare cards and so on. But in addition, a practice that decides to bulk bill everyone will get an extra incentive, about 12.5% on top. So this is meant to help practices who right now charge an out-of-pocket cost move to bulk billing, and it ideally have very little financial impact for them. In fact, for it to be better for them financially, in the hope that that will encourage practices to actually do this and mean that we won't have to pay out of pocket for our medicines. So keen to know for this one, whether you would say thumbs up, this is a good choice. Can we say, if you've got the shocked face, which is the kind of open mouth one, mean not so good choice? If you've got questions about this, so people liking that with the thumbs up, yes. If you've got questions you'd like to ask to better understand this measure, or things you'd want the government to consider as it consults with consumers and communities about this measure, pop it in the Q&A or the chat so that we know what it is you think is important for us to understand. And then we'll move to the next one. The next one we're going to look at is the urgent care centres. So these have actually been, for some people, a great boon, and for others a little controversial. So the idea is here, if you need care out of hours, your local general practice is closed, you'll be able to go to one of these centres rather than a hospital. And you'll see the plan is that by about June next year, that most Australians will live within a 20-minute drive of one of these clinics. Does ensure that you've got a car or there's an easy way to get there for you, but even so, that's a great thing. And 2 million visits once all the clinics are open, that's a lot of visits. So some have said these are really great because, I don't know, I cut myself, sprained my ankle, whatever, and I was able to go somewhere. It was free, it was quick, it was terrific. Others have been more critical, and the criticisms seem to be a little bit commercial. So some general practices saying the rate the government pays in these clinics is higher than what we would get if the person was seen in our clinic, and we think that's unfair, which is understandable. Others talking about fragmentation, so going to an urgent care clinic and then their GP not knowing it, that they've been there, or what happened if they were advised to take a medication or do something else. So that means their care is fragmented in the same way it might have been actually if they went to a hospital and the GP didn't know what had happened. So there's an evaluation underway, but this evaluation is meant to be summative. That is, we won't know for quite some time how the clinics are going. I think there's a general feeling that there's a lot of money gone into these. See how many $1 million this time. I think people are generally interested to know now if they're working, what the issues are and how we're addressing those, rather than wait another year or two for that. So again, very interested to know. Give us a thumbs up if you like the urgent care centres. You can give the surprised face if you're not so sure. great to see there's a couple of questions in the chat already. But if you have any questions or thoughts about these, it'd be really great for you to pop them in the chat so that we know the kinds of issues you'd like us to address. You can see, Bronwyn, you put a couple of things there on behalf of Health Consumers Council Western Australia, so thanks for that. That's great. And now, and we've got a bit of a thumb, so it doesn't seem like this is as people as enthusiastic about the last one as they were the bulk billing. We've got a bit of a poll for you now too. So we've got a question about whether or not your organisation is supportive of the urgent care centres. So you can make your choice there. Yes, no, haven't really thought about it enough. You can put don't know if you're not sure. But do you like this model? The idea that you can go somewhere out of hours, there's no cost, and certain things can be dealt with straight away. And there we go. So strong support, 77%. That's what, a B minus, maybe? B plus, maybe B plus. That's pretty good. The Minister will be pleased to know he got a B plus. He's probably hoping for an A, but we will tell him he didn't quite get an A this time. And so my question would be, pop in the chat, what would make it an A? What would give you next time, next year, if we ask the same question, what would make it an A for you? What do you want the government to do in the next 12 months with these urgent care centres to really get you to be super enthusiastic about them? The Minister is very enthusiastic about them. Let's go on to the next one, folks, which is strengthening Medicare, and this one's health workforce. So we've recently surveyed the community and asked them about primary care, and one of the things that came up really strong was people said, we want more doctors and nurses. We want more doctors and nurses because I've either got a very long wait and I'd like a shorter wait, and I'm thinking if there are more doctors and nurses, stands to reason to be a shorter wait. Or because I think it might help with the costs. If there's more competition, perhaps the costs of care will go down rather than up. So more would be good. Sometimes people also talking about not being able to get the kind of care they want, and they're hoping if there are more doctors and nurses, the kind of care they want might be open to them. So we did get a very strong sense in the community that they would like more doctors and nurses, and we know that we've got a shortfall. So hopefully through the money that's going in here into mainly to general practice, but a little bit also to nursing, we'll see an increase in the number of GPs and also nurses and midwives extending their skills there. And that will help people be able to get earlier access, more affordable access, more appropriate access to care, particularly general practice care. So I'm going to ask you the question again, just before we go to women's health, if you can just go back for a second, Shannon, and say, what do you think, what are your emojis telling you? Are they telling you, yes, this is a good idea, or the surprise face, oh, I'm not sure about this being the best investment they could have made? If you've got any thoughts about this, then do pop them across in the chat as well. Thanks. We've got 1 thumbs up for strengthening the health workforce. 2, the Minister will be somewhat disappointed with your response, but, you know, he'll have to deal with that. A few more people liking it? Great, thanks. But less like, I'd say, than the first one. The bulk billing one so far seems to have got most of your attention. So move to the next one now, thanks, Shannon, which is women's health. So a very big investment, and one that many people would say is well overdue. So it's been decades since you listed new oral contraceptive pills, new HRTs on the PBS. That's astounding to think it's been decades that medicines that many women take daily for years have not been available on the PBS. So what that's meant for some of you that aren't aware is that you might have been able to get it, but you'd have to pay full price. That is, you weren't paying that $31.70 or the healthcare card concession price of $7.70. So the cost for women for these medicines has been higher than perhaps you would have liked, because you can imagine over decades, new medicines came online which the government approved but didn't subsidise. So now what we're seeing is the government saying, actually, we're going to subsidise some of those medicines because we believe that that will help women afford their care. There are also a couple of other things here. There are some maternity services that have been put in place. There are more of the endo clinics, which will be fantastic. They've been very well regarded, I think, by community. And interestingly, there's some money now put in the budget, $100 million or so over the next 4 years, so $25 million a year, to support some national trials to see if women can get access to contraceptives and uncomplicated urinary tract infections in a different way. So many people talk about the fact that when they need a contraceptive or if they need a medicine for a UTI, they need it quickly. And if their GP can't be seen for a number of days or weeks, that doesn't work for them. In many states, there have been trials occurring. There may have been one in your state or territory where the local pharmacist can prescribe some medications that would normally be prescribed by a doctor. They've been funded by the states. This is the first one funded by the federal government. So it's going to also now get into this space and say, could this be helpful to you? There are a couple of other things in there too. There is all of the work that's gone into family violence, we would say is a plus for women's health and funding, more funding in that area. There's some funding for breast cancer drug and also for some tests that people need who have irritable bowel syndrome, which is often a women's health issue. So there's quite a lot of new investments in women's health in this budget. So again, I'm going to ask you, what do you think? Do you think this has been good to see this big investment into women's health? That's a good priority for the government to have taken. Find your emojis, make your decision. Is it time for a party or is it time to be shocked? Anita Beck's and a lie down. Oh, this one's definitely getting a bit more quick support from the community here online. So people liking it. It is time for a party. Great. Great to see all those comments in the chat. Keep them coming, folks. Someone said, hearing like the Prime Minister talk about perimenopause and endometriosis, they never thought they'd hear those words coming out of a male Prime Minister's mouth and a Treasurer's mouth and so on. So that visibility has been very important, that normalising language, that men can say these words and it's okay. Some women have felt very, very happy about that. And yes, still got a bit of a way to go, we know, but possibly a good start. Great. So now cheaper medicines. This is the last one on our 5 measures. So this is again another big investment. So as you know, there are a variety of ways you can pay for your medicine. If you're getting a private script, you pay whatever the amount that is. If you're on a healthcare card, you'll have everything at that $7.70. So there are a range of things, ways you can pay. And we also know that if you paid a certain amount over a period of time, so you'll hit a safety net for the PBS. So when you've spent that amount of money, then the price of your medicines drops down. So investing in the PBS means that you'll be able to get these scripts, if they're PBS scripts, cheaper than you used to, which is terrific. And for women, for example, who might have been buying an oral contraceptive pill and paying full price, now it's gone onto the PBS and the PBS cost will drop. It might mean that it's $20 cheaper for that one script every time they go. However, if the scripts are cheaper, then it will take you longer to hit the PBS safety net. I think at the moment it's something around 50 odd scripts that you need to have before you hit the safety net. I think it'll be something like 64 now if you're on that $25. So it will take you a little longer. So, good and bad. You won't hit the safety net. It also means you didn't spend as much money. But it will take you a little longer to hit that safety net. So there are some new listings as well. So the new medicines listed that weren't available for on the PBS, a range of those, and a bit of a wholesale agreement too, which might help in some other ways as well. So keen to hear your thumbs and your party faces. What do you think about this investment in cheaper medicines? You've heard the other 4. How does this one rate? Is this the best one of all? Are the others better? Thanks for sharing. Sounds like this one's pretty popular too. Now we've done a little bit of a look at what the budget might mean for various other groups. So we might just run through those. And the first one is, of course, First Nations. So what does the budget provide for our First Nations community, recognising that their health outcomes are often poorer than those people who are not Indigenous? So there are some measures dedicated to the First Nations health care and health workforce more generally. NACHO has come out and said they're pleased about the measures and they think they could have a positive income. I won't read everything on this screen because you're getting the notes, as you know, and also you can all, I'm sure, manage to get through this detail, but there are some good things in here. On the next slide, there are a few more things here related to First Nations. You can see those there as well. And then I just want to add in the rural and remote. Yes, there are First Nation people don't only live rurally and remotely, but often they do, and then they'll be disadvantaged even further, potentially, by both racism and rurality. So I mentioned earlier that the rural and remote groups have a bit of a mixed view about the budget, but the bulk billing, if they're not being bulk billed locally, may really help. So if your practice is now going to get $84 in addition to the normal consultation fee through an incentive, that's a big difference. And might encourage people to take up bulk billing. We still do know that the outcomes for people living in rural and remote Australia are not as good as they are for people living in the city, and that needs to change. And there are some criticisms, certainly, of the budget. There's not enough done in this budget. Just also worth looking at other things that are in the budget that can help. There's some more money being invested into Services Australia, so those people on income support will benefit if their claims or issues can be dealt with more quickly. That's usually a good thing to happen for those people that having to regularly interact with Services Australia for a variety of reasons. And the Treasury cost of living things overall, other measures that are in place will help. One is that the increased threshold for the Medicare levy, which means that some people who were paying the levy won't have to pay it in the future, which might help people to just spread their wages or salaries a little bit further. There are some other things you can see in the budget that will have varying cost of living benefits for communities. There's just a couple we've pulled out. So now we're going to have a little look at what we've called the budget lowlights. If those are the highlights, if we've just all seen the highlights, well then what are the lowlights that people are talking about in the budget? So the first one I mentioned before and I mention again is that the Raise the Rate campaign has not got the traction it needed, and there's still no increase in income support payments. So for a young person living out of home on youth allowance, $47 a day. I don't know how anyone was supposed to live on $47 a day. I don't know if you could live on $47 a day. I certainly couldn't. For your rent, for your medication, your food, your clothes, for everything that you need. And so we know that poverty and material deprivation will have a huge impact on your health and wellbeing. They're not separate, and we really need to do something to improve that. We're hoping perhaps this election might bring some welcome relief. I mentioned the PBS safety net and how it's great that medicines are cheaper, but that might mean some people don't hit the net for a little longer. That may, in the long run, work out still to be okay. Overall, they might get a benefit. And I think the other thing we've been talking a lot about is the need to automate this safety net. So you won't qualify for the safety net unless someone is counting your medicines. And you can do that yourself with a sheet you get from the government, and you have to take around and get stickers on and fill out to every pharmacy you go. Or you can make the choice to only go to one pharmacy and then ask that pharmacy to register you. They are paid by the government to do that, and they will keep a track of your medicines. We think that you should just know if you're nearly at the safety net, and the government should tell you, woohoo, you've hit the safety net, from now on your medicines are cheaper. That doesn't happen right now. And some of you might have seen in the media last week talking about the fact that last year, 2024, about 500,000 Australians who qualified for the safety net, that is, they spent that amount of money on the PBS, didn't actually get the benefit because they weren't registered. That's a huge amount of Australians who would have got cheaper medicines, and we're now talking about hundreds of millions of dollars they spent on medicines that they spent because they didn't know they could register, access a safety net and get cheaper medicine. We really feel that this is important, and there's no movement forward there. Allied Health, I mentioned earlier on, particularly the Allied Health Professionals Association being unhappy with the budget. When we're talking about investing in primary care, of course, we're talking about allied health. People were needing to go not only to their GP, but then to the psychologist or to their dietitian or to their physio. And while they might get a bulk bill now from their GP, they've still got to find those out of pockets for all those other organisations, speaking to those different health professionals. We think that that's really needs some urgent reform. And similarly, specialists costs. People are telling us they cannot engage with their specialists. They just simply can't afford it. And we know that specialist appointments are well above the schedule fee, which is $80 odd for your first appointment and $40 for a review. I don't know if anyone here has recently had a review by a specialist that was $40. If you do, please put it in the chat. People would love to know. Dental as well, yeah, that's right. Many people not engaging in dental healthcare either because it is expensive too. So there's this medical cost finder, which we think will help a little, but the assumption the government's making is that if we put all the fees up, that first of all, people can see what the fees are. That might help because you might have to find a cheaper place closer to you that's appropriate for your care, but also that it might create a little bit of a competitive tension with people dropping their prices. I don't know about the second bit. I think, yes, it might help you see what it would cost, but I don't know that it would necessarily mean any change in prices. Again, pop in the chat, be really interested in what you think about this. But even with these changes, there'll have to be legislation. It's going to take a long time. It's not going to fix it overnight. So we still remain with this issue that people can't get all of the care. So I think we'd all agree, I could see from your kind of, smiles and happy faces before that, yes, bulk billing in general practice is important, but equally important that whatever care you need is that is essential to you is affordable. So if you can see a GP but you can't afford your medicine, you can see a GP but you can't see a specialist, you're still going to have issues getting all of the care that you need. Thanks, Shannon. So some other lowlights, Janie mentioned dental, yes, oral health care, really not anything much in there. In fact, a cut in funding in real terms, and we think this is really disappointing. There's been a lot of people pushing for improvements to oral care and the cost of oral care for a long period of time, and we hope that that'll come sometime soon. Mental health, I mentioned that earlier as well, no big investments here either, even though we know that this is an area of unmet need. We also know artificial intelligence doesn't really get a mention, but it's really transforming healthcare. It's surprising that even across the whole of government, not only in health, it wasn't something that the government called out and said, we need to, build some guardrails. We need to work out how this should be. We need to do this quickly. There's definitely more that needs to be done. And there was not a lot in there for our sector. So we didn't see individual peak bodies getting funded to do particular pieces of work or funding that looked like it would be for grant rounds for our sector to engage with a lot of the work that the government outlined. All of the initiatives need consumer input, they need your organisation's support, and there wasn't really any evidence that there'd be any funding to do that. Maybe an assumption that it'd be BAU for all of us. But of course, as you know, we're already pretty busy and doing extra things is sometimes a little challenging. Thanks, Shannon. The National Consumer Engagement Strategy and Health Literacy Strategy. Some of you might do what my 14-year-old would do at this point and roll your eyes, because these have been waiting for a very long time for some love and still no sign of the strategies or any funding to implement them. We can say the same for preventative care. We have a national preventative care strategy with no funding allocated, despite the government saying it would get to 5% by 2030. So we have these great strategies, often which have involved a lot of consumer input, and then nothing to actually fund the implementation of these strategies, which is critical. And when you go out to community and ask them what they think, value their opinion and write a strategy and then don't fund it, it does diminish the trust and credibility you might have with whoever it was that came out to see you, whether it was a peak body or a government or a Big Four consulting firm, because you've told your story, sometimes quite painfully, sometimes not, and then you've seen nothing come of it. So there is a real risk when we have these strategies and they're not then funded, that this will impact on the community's view about engaging in the future. And climate change. No funding to implement the National Health and Climate Strategy. Instead, the funding's gone into those measures that we've already looked at. So I think there was general broad support that these were good measures, but there are always trade-offs. And I think in these lowlights, what you're seeing are the trade-offs. We invested in these things, but that meant we didn't invest in these things. And the question for all of us is, are we happy with that? And if we were to write to the Minister, would you like us to say that we're happy with the trade-offs that are made, or we feel that something different would have been good? Okay, let's move on. We've got another poll now. This is going to ask you about where you want to see the priorities in the next budget. I'll give you a minute because there's a few there on the list. Have a little bit of a think. Great, thanks, folks. We'll share that with you in a moment. I know it's hard, a single choice. I'm sorry, maybe it's a bit mean, but we really want to get a sense of where do you want to prioritise. It's always more effective if you go to government and say, we've all had a chat about it and we just think this is where you should head. There you go, prevention, 60% into prevention, others small areas. Thanks, folks, that's helpful, and we'll make sure that that message is heard loud and clear. So that's quite a strong message. So next one, thanks, Shannon. So where to from here as we're nearly ready to finish up. So first of all, I think we really like you to reflect on these measures, and some of these things are going to come out. So the next step is to make sure that you know and you tell other people. So in the next few months saying your cost of your medicines should drop down in January, telling people that bulk billing incentives are coming, and to ask for that. And we'll continue to advocate. It's an election campaign for those things that we've said already. So dental, climate change, health, prevention, all of those things. We'll continue to advocate for them, and also to advocate that peak bodies are provided with the capacity to build the capacity of the consumer and communities that they work with, so that those people can be at the table, be able to have those strong conversations that are needed, and continue to work with people in many different environments. So we hope that while the budget didn't deliver against all of our asks, we're going to continue to advocate for these things during the election campaign that you can see on the screen there now, such as oral care and the like. And we hope that that will be able to make a difference. I mean, the budget is almost over, but of course our job is not. We're also going to continue to vigorously empower consumers and argue that it's our health and we should have some control, and work with people to try and get that message through to the members of the 48th Parliament. And think about early on, well, what do we want from the next budget? So we've asked you that, but we'll keep asking that. And make sure that people understand these changes over time. Now, for those of you that haven't gone in yet to the budget, there is a whole lot of papers there and some explainers and fact sheets. So these are here. If you go to budget.gov.au, there's a whole lot of information. If you go to health.gov.au, there's links to the health. And there's all of these kind of simple explainers. They can be very helpful, particularly if you're wanting to talk to community about what is in the budget. I'd also just like to mention that we've got a couple of things coming up for our members. There's our Members Policy Forum. It's a members only meeting where we share information. This year's reform forum will focus on health reform over the next 3 years, and also look at some of the results from our consumer sentiment survey, which is really fascinating. Also like to mention that we've got the next one of our digital health webinars, which is on privacy and cybersecurity in the My Health record. This is really aimed at people who use the record, so I'd encourage all of you, if you would like to come along, and also for you to, when you see the link, share it, because this is available to anyone. We can have 1,000 people on this Zoom. If 1,000 people want to come and hear about this, then we really encourage people to come along to that as well. And you can see that the link to register. And we just mentioned that here are some of our handles. We're always keen to hear from you. Myself or Joe, who heads the policy and research team, do reach out to us if you've got questions. We'd like to know how you think we're going and if there's anything else you think we could do. We did mention that we will provide you with a copy of this. It'll go onto our YouTube channel and we'll send it out to our members with a link to the video so that you'll have that and a bit of a cheat sheet on the budget as well. So we've got a couple of minutes left. I'm going to leave you a little bit of time now for you to put your comments in. We do this every year, always keen to know, did this hit the mark for you? Would you like more information about something or less about something? That's always helpful to us so that next year we can make this even better each time. If you've got any last thoughts about the budget, thanks for the love, folks. If you've got any thoughts about the budget, do pop them into the chat. We'll leave it open for a few more minutes, so you'll be able to add that in. Remember, we are going to write to the minister, so tell us, what do you want us to tell them about the budget? Seems to me the general view was, love the medicine stuff, love the bulk billing stuff. I'm not so sure what you want him to do next. Like if he came to you and said, well, what should I do next? What do you want him to do next? What do you want to see in election promises? What do you want to see in next year's budget? What do you want to see the 48th Parliament to do? Really great to know that because we will share it with all politicians. I'm not suggesting you need to share to please him, Leonie, but keen to know what it is you would tell him, though I think I know what you would tell him if he was in the room right now. It'd be something to do with oral health, but maybe there are other things too that you think need to be changed. So do put those in there if there are other things that you think they really need to be addressing. And otherwise, you do follow us if you don't have our newsletter or you're not following us on socials. We really love you to do that. Angela, hear you about the health and climate strategy, and we can make sure we include that in our letter to him and in our advocacy efforts over the next 5 weeks. While we've got the attention of politicians potentially, as they're trying to get elected and wanting to know what would the community want them to do, let's tell them. Let's tell them what it is that you want and what our member organisations want. And feel free to contact us afterwards if there are other things that your organisation thinks should be on the agenda. Do let us know because we're really happy to represent on your behalf. Otherwise, I wish you a happy Friday. I hope you have a relaxing and healthy weekend. And now we look forward to the drama of the election campaign. Thank you, folks. Thank you. And big thanks to the team at CHF for organising all of this today. So many people, Shannon driving the slides, Ben, the policy team, so many people help with this. So thanks to all of them. And if you're still here, feel free to give them some love too.